Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week ending December 10th, 2020. I'm going to divide my talk this week into four sections: a few words about the new vaccine, the growth of the global pandemic, cases, hospitalizations, and deaths in the United States, and the status of the pandemic in our region. Obviously with the vaccine, there's some good news. The United States has approved the first COVID vaccine for emergency use authorization. That's good news. We joined Canada and the UK in having approved it. And the vaccine appears to be quite effective. If you look at the chart released by Pfizer, the red line is the number of cases of COVID in the placebo group, and the blue line is the number of cases in the vaccinated group. And you can see that for about a week after the vaccine, up to 10 days, there was really no difference. And then it starts to level off pretty dramatically. So even before they get the second dose at 21 days, it looks like there's good effectiveness for this vaccine. The vaccine also appears to be reasonably safe with mostly local side effects. The most common are pain at the injection site, fatigue, headache, fairly minor symptoms, but not insignificant. And in terms of serious adverse events, not significantly different than the background that would be expected publicly. So a vaccine that appears to be effective, appears to be safe. Remember, it is emergency use authorization. That means the company needs to continue doing studies to determine the longer term impact, if any, on the vaccine, both in terms of effectiveness and safety. One thing to point out, however, and that is the distribution is very limited. The Tennessee, I believe, expects to get about 60,000 doses. That's about 30,000 people, since each person gets 2 doses. That's less than 0.5% of the population. And I think the same is true nationally. If we need to get something like 70% immunity to get herd immunity, we do have some natural protection from the disease, we think, but half of 1% isn't going to change things very dramatically. So the most important thing to remember about the vaccine is, we got to get it, but it's not going to significantly impact the spread of the pandemic for at least a couple of months, optimistically. In terms of the pandemic, it continues to grow worldwide with almost 1.6 million deaths, 70 million cases, and about a 5.1% increase in the past week. We've been following this week-to-week increase, and you can see that over the past month or so, it's been hovering at about 5%. At 5%, if it continues, we will expect to get to 2 million deaths worldwide in about 5 weeks, just after the turn of the new year, and it'll double in about 14 weeks. What this tells us is that the pandemic is still growing. In terms of the places that are most heavily impacted, this hasn't changed a lot, but the numbers have changed a lot. On April 20th, Belgium was the most affected country in the world in terms of death per million. They've now tripled that number. At the time, the U.S. was about in the top 10 somewhere, but we've gone up almost 6-fold, almost 7-fold in that time. So again, continuing to spread everywhere. Early on, the deaths were in China, then they were in Europe. Then over the summer, they were largely in the Americas, but look at this, now coming back in Europe. So what we understand about this is that this is a pandemic that doesn't seem to be going away. It can impact the same place more than once. So certainly something to keep an eye on. In terms of cases, hospitalizations, and deaths, remember the progression is this. You would expect to see cases first, followed by hospitalizations, followed by deaths. In terms of cases, this is where all the cases had been in the U.S. as of August 13th. Here are the cases in the last 2 weeks. Again, this just broad national impact. Again, we've tried to create a time lapse here. And what you can see is starting in late July, week upon week, there wasn't really a lot going on. And then we start seeing these cases in the southeast and then the central northern part of the country, the Dakotas, Wisconsin, and then fairly rapidly just spreading out from there. This is the pattern now, again, back into some areas that appeared to have cleared out before. Obviously, it's most graphically if you look at July 31st to December 10th. In terms of cases, you can see that there was this upsurge in cases in March and April, followed by a slightly bigger curve in July, and then a bigger curve yet most recently. Now, I'm not a big fan of using cases because it is very dependent on how many tests you do. So I like to look at things like hospitalizations and deaths, which are pretty immutable. They reflect what's really going on. In terms of hospitalizations in the U.S., you can see this continuous growth rate at about 4.3% over the past few weeks. And what you can see is the growth rate in the last couple of weeks is the greatest it's been since early August. That tells us that the pandemic is still spreading in the U.S. pretty significantly. And of course, hospitalizations eventually lead to deaths. And the number of deaths in the U.S. has now almost hit 300,000. It actually has by the time I'm recording this. Again, you see this triphasic great increase in deaths in March and April, a slight increase in early July, and then a pretty significant increase, in fact, going up more than we saw in the early phases of the pandemic, and a 6% increase over the past week. And that's huge. If you look at it up close, you see that's really the most we've seen since early June. So this pandemic is not going away. It is significantly impacting our country across all the borders. And at 6%, we'll expect to get to 400,000 deaths in about 5 weeks. So this is a significant problem. Here's something I wanted to show you. Back in April, I made this chart that shows all 50 states in the United States. And there's New York, there's Tennessee, Virginia, North Carolina, really insignificant amount then, even though we were paying a lot of attention to COVID back in April. But now I want to bring it up to the present. And what you can see is just massive numbers. The average that the U.S. overall is about where New York was in April. And you can see that Tennessee is now quite significantly ahead of North Carolina and Virginia, and getting close to the nationwide average. So again, this pandemic is still spreading. It's still killing people. It's still putting people in the hospital. It's still putting a significant burden on us as a people. And I continue to be both disappointed and surprised at how many people continue to act as if this isn't a real thing. It really is. And we see that perhaps more clearly here in our region. 5,400 deaths in Tennessee, 4,400 in Virginia, 5,800 in North Carolina. But again, as I pointed out before, it's better to look at deaths per million. And you can see that Tennessee is about 50% worse than Virginia or North Carolina. In terms of Virginia, a 4.5% increase in the past week, pretty much about where it's been all along. It seems to be a slight decrease over time. But again, early on, the cases were largely in the metro areas. In the past couple of weeks, is in the more rural areas, and especially in the western part of the state and in our region. Tennessee, deeply disappointing, continuing to have very high week-to-week growth rate. 10% a week is just awful. That's doubling in about 2 months. If you look at where the cases were in August, as of August, largely in the metro areas. In the past 2 weeks, it has been everywhere in the state. In terms of hospitalizations, this is Tennessee's overall. I want to make a point. Some people think that this is just a disease of the elderly, but here's cumulative hospitalizations for under 18, 18 to 49, 50 to 64. This is a pandemic. Yes, it does tend to kill people that are older, but it affects everybody. The week-to-week hospitalization rate is the percent week-to-week change is about as high as it has been since late July, early August. So it looks like it was coming down and then starting to pick back up again. In terms of our region, you can see clearly we're right in the heart of it. The ballot health catchment area reports 827 deaths, about a 9.4 week-to-week growth rate, exactly where the state of Tennessee is. That would mean the doubling of deaths in about 8 weeks. Think about that, twice as many deaths in 2 months as we have right now. So the bottom line is the vaccine has been approved, but supply and distribution suggests that optimistically it'll be several months before we really see an impact on transmission in our country. The pandemic continues to spread around the world with over 1.5 million deaths, expected to reach 2 million in about 5 weeks. The European countries have seen a major resurgence about 6 to 7 months after the first wave. And this is something we really have to watch out for, both in the US and around the world. We're still in the top 10 with 900 deaths per million all over the country, and expecting to hit about 400,000 deaths in about 5 weeks. And Tennessee overall and the Appalachian Highlands appear to be in the heart of one of the most impacted areas, and we expect a doubling of our deaths by mid-January. So the bottom line is, until a sufficient number of people have been vaccinated, there is nothing we can do beyond what we know we can do already. Please avoid unnecessary crowds, wear a mask, stop arguing about it, engage in social distance, which means minimizing the time you're near people and maximizing the distance. There is no magic distance. We say 6 feet, but chances are if you're even farther away from someone for a long enough period of time, you could get exposed. Implement good hygiene, of course. Stay home if you're sick. Conduct widespread testing and contact tracing. Pay attention to quarantine isolation. Protect the elderly and those with chronic diseases. And let's treat each other better, okay? Let's stop arguing about this. Let's let the facts guide what we do. This is not a political issue. It never was. This is a public health pandemic that's affecting people around the country and around the world. There's a great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list and know anyone who would, please contact Jan Stork. Thanks, as always, to Dara Young for editing, producing, and posting this video. If you have any questions or any topics you'd like to see us cover, please let me know. I answer a lot of questions offline. I make some videos when people have specific issues. But if there's any comment, question, concern, criticism, please let me know. I look forward to hearing from you. Thank you very much.